Okay, let's look at this one that says mode of action, symptoms, and treatments first. Looks like this has the 2 lines on it. This just has a little bit of vocabulary on it that I wanted you guys to go over, just so that you'll know the difference in what some of these are talking about. So therapeutic effects, it says, remember, therapeutic is like how it's working or that it's functioning like it should. So it says this is a desired or intended effects refer to primary purpose of prescribing and administering the medicine. So we're talking about the effect it working because of the reason that the medicine is supposed to work on this one. With the lines on it. It says mode of action, symptoms, and treatments. It says medication is a substance with therapeutic value. I love that. Side effects are unintended or secondary effects. So they may or may not be harmful, but they may permit the drug to be used for a secondary purpose. So sometimes people take the medication actually because of a side effect that it has. That could, potentially. Adverse effects are undesired effects that may be harmful. So they may damage function of vital organs over a prolonged time, or may be minimized. These may be minimized by reducing dosage, or maybe switching to a different medicine. And so an adverse effect is going to be harmful in the end, like liver damage, or deafness, whatever, something that's harmful. Toxic effects can be extremely harmful. Sometimes they can be life-threatening, and it implies an actual drug poisoning, like they have too much in their blood. It says poison is any substance which, when ingested, inhaled, or absorbed, or when applied to, injected into, or developed within the body in small amounts by its chemical action may cause damage to a structure. So anything can be considered poison, whatever substance it is. It says toxin is a poison frequently used to refer specifically to a protein produced by some higher plants, certain animals, and pathogenic bacteria. So some bacteria can be toxic, which is highly toxic for other living organisms. Such substances are differentiated from the simple chemical poisons and vegetable alkaloids by their high molecular weight. Specifically toxins is what that's talking about. And look at this last one, or number 3. It says toxicity is the quality of being poisonous, especially the degree of virulence of a toxic micron, or it's just talking about toxicity. That's all. You have to stop the drug, and then there may be something else that they have to give, like an antidote. You've probably heard that word, antidote, before. And a lot of the medications have antidotes, like the narcotics. If they are starting to cause severe respiratory depression, like the person is not breathing or breathing really shallow, they can administer an antidote. One example of those is called Narcan. One example of that. But it makes the medicine stop working immediately. So if they're taking that for pain, and then they're given that Narcan, then their pain is going to come back immediately. It's going to be I had a kid one time at Children's who needed to be sedated. We did a lot of conscious sedations in the emergency room for procedures or whatever. So we give them the medicine. There had to be a registered nurse to monitor, or a respiratory therapist could monitor, and then after the nurse gave the meds. Anyway, so there was a hospital actually in this area that had given the medicine, and they had given so much of the medicine to sedate her. It was a child too, and that they over sedated her. So then on the way to Children's, they had to give her I don't know if it was Narcan exactly, it probably was, but some kind of antidote for the sedation because she was so sedated. Well, at that point, because the sedation had already occurred, then she could be sedated again for 24 hours. And they weren't even able to do the procedure, Anyways, it was kind of mess. But so sedations are a big deal, and, they just have a lot of effects on the body that you don't realize really. That antidote, once that's been administered, it's that it's not going to work at all anymore. And there's lots of things I don't think we haven't talked about Coumadin yet, but that's a pretty frequently prescribed medication. and it's a blood thinner. It's like a really heavy-duty blood thinner. People have to have their blood, they have to check what's called a PT and INR, and that checks, it checks clotting time. So how fast their blood, will clot after, there's an interruption or something to a blood vessel wall. Well, the reason that people take that is because maybe they've had open heart surgery, or they've had a history of blood clots. And so they take it to make their blood so that it won't clot up in their blood vessels. But it's a really potent medicine. And sometimes their INR can get too thin, like their blood gets so thin. We say thin, it's not thin is not really a great word to describe it, but that's how we say it. That they literally, they might have like hemorrhaging under their skin. They might bleed out through the GI tract or something like that. All of those are emergencies, and they've got the antidote. The antidote for Coumadin is vitamin K. It's a vitamin K injection. It's because vitamin K increases those clotting factors. So antidotes is something you'll hear about. And that's something that you'll find on here that they ask sometimes too, is the antidote. Causes of adverse and toxic effects. All drugs are potentially dangerous. Okay, all of them can be dangerous. Tylenol can be dangerous. Many medications used for everyday illnesses or chronic diseases are considered as harmless, especially if over the counter. But again, they can all be if they're taken in, the right amounts. Over the counter perceived generally to be safe since no prescription is required. Prescribed medicines are assumed to be safe since a physician would not prescribe something that might harm the patient. But that's one thing that can get people into trouble, is just not knowing, or forgetting that they've taken something more than once. Kids getting into it. I saw lots of kids when I was at Children's who had accidentally gotten into their grandmother's blood pressure medicine, or one kid, one time their grandmother had accidentally given them their medicine instead of the baby's medicine. And, those things happen. So any of it can, it's really, you just have to be careful. There's no letting your guard down. Lack of understanding, drugs can cause toxicity even if they're taken as directed. There are some medicines that, depending on the person and what's going on with them, they can be toxic even if they take them just the way they're supposed to. They just like that Coumadin, it can make their blood, it can cause hemorrhaging even if they take it the way that they've been instructed. That's why you have to recheck their blood levels often. Overdose is taking more than prescribed or advised, so we know that. People can do it accidentally, or they can do it on purpose. So, I've heard of people, that Duragesic patch, and I already told you this.
The guy that ate them?
Yeah. It's a lot of medicine at one time. 3 days worth of medicine at one time. So, age. Child may be unable to metabolize at the needed rate if the dose is too large. So, like an adult dose of Tylenol. One thing that I've seen a lot about in the news lately is, and I think that Tylenol has changed this, and Motrin has too. They used to offer an infant's dosing of Tylenol and a children's dosing, and they were different. Like the infant, you just had to get a few drops. Well, it was so concentrated, people were getting them confused. And so people thought they were giving, like a children's Tylenol dose of the infant's Tylenol, which would be significantly more Tylenol than what they needed. And but I think now they're making it and it's all the same dosage. But Tylenol usually can be given to babies after they're like 2 months old, they can have Tylenol. But Motrin, they can't have it until they're 6 months old. Elderly, and I may be wrong on the Tylenol, but I think it's 2 months old, because I think with both of my kids, the first time I could give them Tylenol was after their first set of shots, and that was at 2 months. So. Of course, with the elderly, metabolism is slowed down, so sometimes drugs can stay in their system longer than they normally would. Their organs, their liver, the kidneys might not be working the way that they once did, so those levels can just build up, Disease, of course, some diseases can either weaken the organ and make it like their kidneys or their liver and not be able to metabolize it or get rid of the drug like they need to. But then there's other diseases that actually have an effect on the drug itself. Drug interactions. As may react with other drugs creating toxic substances when combined. So that's like a reaction where they create something that the mixture of them is toxic. Or they can have an effect on each other. So one drug might make another drug more potent, or might make another drug less potent. Like, and I've seen this question on here before, but one example is a lot of antibiotics make birth control not work. So, and I'm pretty sure I've seen that question on here before. So that's something that people would need to be advised of, you know. Medication may interact with certain foods, leading to toxic buildup, or it could slow down the metabolizing, or it can make it work. Kind of like I was saying, vitamin K is the antidote for Coumadin. Well, it's the same thing. If you take, if you eat a lot of vitamin K, so let's say I decide, okay, I'm going to go on a diet. I'm already taking Coumadin, and then all of a sudden I start this diet where I eat 2 salads a day. Well, green leafy vegetables have a lot of vitamin K in them. That's going to make that Coumadin not work like it's supposed to. Okay? Now, most of the time what they tell you in something like that is to take your normal amount, like eat your normal amount, and so they can adjust your dose as to how you normally eat. And, you know, you may need a little bit more or whatever, but if you all of a sudden start eating a whole lot of it, that's going to mess with it. Allergies, patients' reactivity is altered due to previous contact with the drug, acting as an antigen or allergen. They are really unpredictable. People can be taking a drug forever, and then all of a sudden they get allergic to it. Or they might have an allergic reaction to it the very first time. Or it might be like the 3rd time that they take it. Sometimes it takes them a while for their body to actually build up the allergy. Idiosyncratic just means that they don't know. They don't know why they might react that way. It's not typically dose related. It doesn't matter if you give them a lot or a little. If their body comes in contact with it, they're going to have maybe caused by combination with other substances, and then just y'all know the symptoms of an allergy. So anytime if somebody were to come into the pharmacy and they say, oh, I took this medicine, you know, I feel like my throat is really swollen, or I got a rash, my face puffed up, those are all signs of an allergic reaction. And a lot of times the first time the reaction may be, you know, maybe they developed a rash and their face got really puffy, but the next time it could be worse. Could be better, but it definitely could be worse. I've seen a lot of times where, you know, it gets worse over time. So, and it's not, you know, that's something, I mean, it's a medical emergency. If they feel like their throat is closing up, they need epinephrine, you know, EpiPen we talked about in CPR. Now at the hospital, they don't give them an EpiPen, they just give you the injection itself. I had a kid one time, and I may have told you the story before too, but who came in, had an allergic reaction, and I don't remember what the allergic reaction was to. Came in, we gave the epi, kid was doing good. I think we gave maybe like 2 doses or something, then need another dose, and it did good for a long time. So we're like, okay, well, they can be discharged to go home. Well, their ride wasn't there yet, and so they were just sitting in their chair waiting on their ride, and all of a sudden the kid started having trouble breathing again. And this is hours after they'd already gotten their epi, they'd already been exposed to it. Ended up in the ICU because he had to have so many doses of epi at that point. It's not their breathing necessarily made them need to go to the ICU, but after a certain amount of doses, they make them go up there. And so, I don't know, they're just really unpredictable. Treatment, overdose and toxic effect. So inducing emesis, now that means inducing vomiting. That is not going to be your answer very often. Okay, there may be some specific things, specific drugs that somebody might take that you would induce vomiting, but 9 times out of 10, when that is an answer on the tests or the quizzes online, that's not usually the answer. Unless it's something specific and they specifically said induce emesis immediately or whatever. Because a lot of times those drugs can have a worse effect on the esophagus coming back up, than they would going on through and giving them something else. Gastric lavage, which is I think that's like a washing out. I know we used to do that in children's, but I never actually got to do that. Activated charcoal, I talked to y'all about that the other day. That's a lot of times given for a Tylenol overdose. And so, it's gross. It says in some cases reducing drug levels may be sufficient, so sometimes they can reduce those, or they might give like an IV fluid to increase the amount of fluids in your blood vessels and decrease the concentration of the drug. That's another something that they can do. Reduce the dosage and how often it's given, and then intermittent discontinuation of the drug. So they might skip a dose until serum levels get back down to a normal range. Allergies, we already did that. Supportive treatment, so kidney dialysis in case of renal failure. These are, supportive treatment is like you're not necessarily giving this to, cure something, fix something, or whatever. Kidney dialysis, antidotes, mechanical ventilation, so just ventilation, like life support is what I was talking about. It doesn't have to be life support, just mechanical ventilation. Administration of drug binding agents like Digibond. It's like an antidote, same idea, but it binds up the drug so that your body can't use it. Digitalis is a hard medicine, a pretty potent one. And it's a very frequently given medication. Prevention of any of this, of course, is education. That's the biggest thing, just so that people know what's expected, what to report if something is unexpected. And I don't think it's great for every single person to read the 9-mile long insert that you get with every medicine. Otherwise, they're going to think what? Yeah, they're going to think they have every single side effect that's listed on it. Okay. And a lot of them, you don't even know that you have, but you need to know what the big ones are, what you need to report to your doctor. Need for monitoring of serum levels. What that means is these drugs, a lot of times, they're going to have blood work to check and see how much is in their bloodstream at any given time. So Digitalis, that's the heart medicine I was saying, anticoagulants like Coumadin, some antibiotics like gentamicin and amikacin. Vancomycin is another one that you check blood levels on to make sure that they don't have too much, because all of those can be really, if they get too much of those in their system, they can be toxic. Vancomycin, for example, is ototoxic, which would mean what? Oto. Ear. It can cause deafness. Lithium, that one is given for bipolar disorder. Phenobarb is a seizure med, so those are all different things that you would check for. And there's other ones. There's lots of other meds. There's lots of seizure medications that they check blood levels on frequently, just to make sure they're not. And those psychotropic medicines, some of those too, the really heavy duty like medicines for hallucinations and that kind of thing. They'll check those. Okay. Just wanted to kind of give you guys a little vocabulary so you know what all of those words mean when you're looking at them. Okay, let's talk about routes of administration. Dosage forms. Go on to your Chapter 5 PowerPoint that goes with the pharmacy technician.
Which starts off like overview, drug names, and drug sources.
Yes. So we'll look at some of these. Some of this we've already kind of gone over, but some of it we'll review. Okay, drug names. Most drug entities are known by several names or designations, as these include chemical, generic, and trade names. So when you hear that word trade and brand are interchangeable. So they may say either one of those. brand name, trade name. And a couple says the generic name is the official name of the drug. It's going to be called that name. Whoever makes it is going to be the generic name. Okay, like ibuprofen, for example. Sometimes one brand name is Motrin, another one is Advil. I don't know, whatever the brand is that, dollar store makes or whatever, so that's an example of that. Aspirin is another one. Aspirin is the generic, but sometimes it's called Ecotrin, sometimes it's called, I don't know, it's got all kinds of names too. The trade name is assigned by the manufacturer and is protected by copyright. The other thing to know about these is whenever you see them written out, the generic name is always going to start with a small letter, not like capital. Lowercase, there we go. And the trade name or the brand name is always going to start with a capital letter. Okay, so like when you write acetaminophen, it's going to have a small A. Tylenol would have a big T. Okay. And sometimes if they're written together, you'll see the generic in like parentheses or the brands. Okay, drug sources we've already talked about. Okay, let's go over to dosage form on the next page. Drug dosage forms are classified according to their physical state and chemical composition. Gas, liquid, solid, semi-solids. We're going to look at some of these. So some substances can change from one state to another. You know that. They can be melted. Vaporizations like albuterol in a nebulizer. You know what a nebulizer is? The machine, you'll see a lot of times people will use it anyways. You just plug up a hose to it and mask, and I'll put it over the nose. And a lot of times you'll see
like a breathing machine?
Yes.
Oh, okay,
it's called a nebulizer. And it's neb is the abbreviation for it. And that's what it is. It's got a little canister in it, and you put like liquid medicine down into it, and then it's dispersed over, a certain, usually 8 or 10 minutes. Kind of depends on how fast they breathe. Do what?
When I take mine like make me shaky and tired.
Oh, yeah. Well, that's the medicine.
It's been like when I had
I always took mine before I went to bed. That way I can do that.
one of these kids has like a big mess that he has put on, and like shakes it the whole time. The big mess, yeah, the big mess like shakes.
Oh.
And like beats, they said it beats like the stuff off the inside
Who
of the
is
lungs. JoJo,
Oh.
these kids, and it beats like the stuff off the inside of his lungs or whatever.
Yeah, it's like it works, and you can do that like with your hands too. It's called percussion. And you just but it loosens up those like all of that fluid in your lungs.
You know, funny to see him trying to build a Lego tower with that on. He's like trying to put it together. He always misses it. It's funny. He'll be sitting in the floor. He's like.
Okay, solid drugs. So we have tablets. That may be chewable, sublingual. What would sublingual mean?
It's
under the tongue.
Yeah.
Lingua's tongue, so under the tongue.
So
Enteric coated. What word do you see there? What is enteric?
where did you see that? Oh, I'm lost.
Under solid drugs. Talk, Brian.
Oh yeah.
Enteric. Where have we seen that root word before?
Interior? I don't know. Like it's between something down.
Oh, it's a body part. It's a small intestine.
Look at you go.
So, enteric coated. What that means is sometimes you'll see it. It'll say EC on it. Okay, and that just means that it's not going to get dissolved in the stomach. It's going to get on through, so it won't be so hard on the stomach. Like aspirin, for example, can really be tough on the stomach lining. And so a lot of aspirins will say, EC on it, and that's what it means. It's not going to get absorbed until later on in the GI system, so it doesn't cause so much damage. Okay. Plasters as composition of liquid and powder that harden when they're dry. Sweet.
Sounds like
I was thinking like
Sounds gross.
plastering, like drywall.
I'm thinking of a specific
Whatever.
medicine, but I don't know if that's if it is considered a plaster. So I won't say it. But
I like that fruit. Is it fake?
No, that's so good. That's
Is it cold?
it's like cold.
Let's get the official definition of a buffered is.
Unless I gotta work. Work the consistency. Next to my mom was like, I need people to work.
Yeah, right.
Copies of-
I spring stuff at work.
I'll tell you exactly what buffered
So
is.
they got it.
Okay, let's keep on. Solid drugs, some capsules. Drug is contained in an external shell. Y'all see the difference between tablets and capsules, right? Capsules come in a little,
Plastic wrap
it's not
thing.
plastic. It's plastic, or it wouldn't get dissolved in your body.
You know what I mean?
Usually gelatin, like that. I mean, it gets sticky, it gets wet, like it sticks to your tongue.
Like my question is, do they like pack those themselves? Or they already
Well, I
come
mean,
like that?
they're probably packed in sheet packs.
Oh, I know if they had like
I'm sure you could.
sealed them somehow.
So,
Like I was
Sure
wondering
you
like
could.
what the pharmacist did. They're like,
I remember when I couldn't take pills. Well, I probably could. And I had to take. Ever tell you about my ringworm I had on my head?
no.
Okay, when I was in like third grade, I had to wear my hair to the side ponytail for like the whole year of school because I got this ringworm on my head, and I like if you're in the same room with me and you have a ringworm, I get it. But anyways, and I got it on my head. Well, do you know what happens if a ringworm gets on your head?
Don't
You
you
lose
like,
all of your hair, and it's a bald spot. Okay, just like on an animal, you know, they have a ringworm, it's a bald spot. Yeah, it was like the size of a quarter, and we could not get rid of it. Like we did everything. I went to the special dermatologist in Dallas. It took like 3 months of using this certain medicine, but it was a long time. Anyways, at one point during that time, I took this antibiotic. I don't know why I would have taken that. Maybe it got infected or something. And my mom would like empty. It was the amoxicillin, you know, they're purple and pink. Y'all ever seen those amoxicillin tablets? Anyways, and she would like open it up and pour it into an Oreo, the powder in an Oreo, and then I would eat it. It still tasted bad, but it was better than. Don't know why I'm such a baby.
I wouldn't ruin an Oreo like that. I think that'd be.
I probably got a good one afterwards, but
Let's say,
I was just a big baby and
and
wouldn't take pills. So, but it says these are used when medications have an unpleasant odor or taste, which definitely is the case for that. But I'm always gonna. Anytime I think about capsules, that's what I think of. That ringworm was horrible.
You're probably sitting there looking at the Oreos like, oh, dang it.
No, I don't think about it when I think of Oreos, but when I think of capsules. Anyway, sustained release or SR, and you'll see that. So you'll see some of those medicines, have an SR behind it. That's what it means, sustained release. So time release capsule, they're released slowly over a period of time. So a lot of times the SR, they might be taken over a period of like 12 hours or 24 hours. Caplets. They sound like tablets and capsules, shaped like capsules, but they're made like tablets, and they're film coated so that you can swallow them a little easier. So they're going to be kind of slippery. Like some Advil, you see those in caplets. They're usually like longer, kind of capsule shaped, but they're actually tablets. Gel caps, oil-based medication enclosed in a gelatin capsule, like fish oil or do what?
Advil?
Yes, some Advil comes in gel caps. Mm-hmm. I don't like those. They feel like horse pills. Too big. Powders, drugs dried and then ground into fine particles. They all use one of those mortar and pestle. Granules, small particles encased in a gelatin capsule. I've seen potassium is one pill that I've seen like this, and they look like little sprinkles inside of a capsule. They're usually pretty gigantic. Most potassium tablets are huge. Troches or lozenges, and you'll see that word again, that troche word, and but that's all it is. It's like something that you suck on, like a secret or something like that. Like a cough drop.
Okay.
Flattened disc containing medicine intended for localized mouth or throat application. Okay, so here's just some examples. Tablets. Caplets, capsules. Oh, there's a really, I probably can't see it on your PowerPoint, but there's a good picture of the little granules. Let's see the picture down here at the bottom. I know y'all can probably see on this. See those little granules in the gel caps. I think these are more like caplets. They're kind of like shiny looking, and they have that film on them, and tablets. And these may be caplets. Those look like Skittles.
Yeah, they do.
If y'all are swallowing a Skittle.
Yes. So hard.
Okay, semi-solid drugs. So, suppositories are bullet-shaped dosage forms, usually inserted into a body orifice. So, rectal, like sometimes people take them for constipation. Tylenol comes in.
Good morning, Bulldogs and Dogettes. It is Tuesday, February 3rd. Happy birthday to Tanner.